My name is Nicola Wilson. I'm the care manager here at Crossroads Care.
I'm Margaret Dengor and I'm a trustee.
We provide care for lots of different people, lots of different carers and cared for of all different ages and disabilities. We also provide care in the community, so that might be supporting our cared for to attend some of our local day sessions, so it could be the day centres. We also provide care for people attending physiotherapy sessions, also swimming, and generally just to make them feel included and part of the community.
I think carers come from all walks of life, and their culture sometimes influences how they perceive their role as a carer. Some ethnic groups tend to think that caring should just be done within the family, and they often don't realise the stresses and strains on an individual carer, perhaps over a very long period. And so when people come to receive our services or inquire about our services, one of the things we have to do, and I volunteer within a support group, I have to try and reinforce or introduce the message that you can't care for 24 hours round the clock for years without some sort of support, and you have a right to that support.
So a typical day for a carer in Crossroads Care could be going to a family's home, helping support get a child dressed and ready for school in the morning. So the child could have complex needs and may need feeding through a gastro tube. They might be needed feeding through an NG tube, which is really complex. So all of our staff need to be highly trained and signed off by our local nursing team.
My background is actually in nursing and management in the healthcare sector, mainly in the NHS. And I was a senior nurse, and therefore when I became involved with Crossroads Care, I was very surprised about what the care support workers were actually asked to do. They cover such complex care and they do it so well, and I just understand the quality of the care they provide. They have such empathy with their clients. I think that is so important as a carer. And as I say, I've used the services for some years. That empathy was really more important than anything.
Receiving the reward for Community Heroes was really a testimony to the volunteers and all of the staff here at Crossroads. It shows really that the council recognised us and the people in our community really understood the work that was done here in Crossroads.
I thought that we received a Community Heroes Award, so well deserved by the team. I was absolutely delighted because actually, although the team work towards all the time providing a top quality service, they don't really get any accolades, but they get them from the users of the service. But it's very nice to be recognised in the broader local charitable environment and just raise the profile of carers in the process, really. When I became a trustee, I didn't realise the range of services that Crossroads Care provided. They not only provide respite care, which I've described, they run a number of services. They run a Saturday club for children with multiple disabilities. They run not only the caring cafe for people with dementia and carers, but they run another cafe where carers can come to gather together and meet each other. And that also includes past carers, which I feel is absolutely important because it's crucial, because when you've been caring for so many years and then suddenly you're caring no longer, your life can be extremely empty. You've not looked after your own life's interests, and so you almost have to start again. It's beyond a bereavement. It is a totally different life that you're going to have in the future, and to be able to give past carers support is so important and not often recognised. We provide a very specific service for men who care. Men are often rather reluctant to come forward and say they need support and need some persuasion. But I have found either men who attend the Caring Cafe or attend the service that we provide for men who care, and they go for a pub lunch or whatever they want to do, they really get involved with those services and they really rely on them and benefit from them. I've had a carer say to me, "You've changed my life," and that's been said to Crossroads Care on many occasions, and I know that is true because it changed my life also.